Hi everyone, this is Adrien, the exercise specialist from the Leduc Beaumont Devon Primary Care Network. I hope you all are doing well today. Today I thought I would show you guys a quick at-home workout you can do for your core. So I'll show you guys 7 different exercises that you can do to actually train your core. So just so everyone is clear, there's far more to your core than the simple, six-pack abs that everyone thinks about on the front. You actually have 3 separate main layers of musculature on the front of your abdomen that start superficially, so up front, and then move deeper. You also have muscles on your side, including your serratus muscles, your intercostal muscles, so on and so forth. And then you have a set of muscles along the back, well, multiple sets of muscles along the back. Muscle groups including things like your spinal erectors, your multifidus, other similar muscle groups kind of like that, your QL, your quadratus lumborum, and many other muscles along the back musculature. So when I speak about your core, I'm speaking about this entire complex that goes around your entire midsection here. So these 7 exercises that I'm going to show you are to train all of those. So each one will kind of train all of the muscles in a bit of a different way. What I will do is I will go through all 7 exercises one time. So I will do 1 set of each. I would recommend doing all of the exercises for 3 total sets, and anywhere between 8 to 15 repetitions. And anytime, if this is new for you or is difficult, you could try doing each exercises, for 1 set of 8 or 1 set of 10 or so, and you slowly build up from there. You can go from 1 set of 8 on everything to then 1 set of 10 or 2 sets of 8 or so on and so forth. As Coach Luna comes to join me. So, and then you just slowly build up from there in difficulty. And that's how you build up from there. And then eventually, once you're doing 3 sets of, let's say, 15 repetitions of all these, you can slowly try to reduce the rest time between each set. That's how you make things work out better and make it more difficult. So like I said, I will just be showing everything for 1 set, but it's expected that you can work up 2-3 sets of each of these 7 exercises. And certain exercises tend to bother you, then there's many other exercises that you can try to implement. I do have a separate video on the channel where I go over what's known as the McGill Big 3 complex, which is developed and generally recommended by Dr. Stuart McGill. That's always a great place to start when you're looking for general core work. So that's always a good place. And this is just to take it a step further with a little bit more intensive kind of core exercises. Not that those exercises aren't intensive, as they are very difficult to do when done correctly. So as per usual, if you are new to physical activity, if you're turning to physical activity from a long layoff, or if you have a medical condition that might make doing physical activity difficult, please consult with a physician prior to beginning any new exercise program. So the first exercise I will show you today is a simple weighted elevated crunch. So there's a bunch of different ways we can do this movement. So the first one is obviously you can just do a standard normal crunch, hands nice and crossed, and you just come up a few inches. We're not coming all the way up. We're only coming from here to here, here to here, here to here. If that becomes too easy for you, you can grab a weighted object. So for some people, if you have a dumbbell, something like that, fantastic. You can come right here, and you hold up, you go up and down, up and down, up and down. If you don't have a dumbbell, like I showed in a separate video, something like a milk jug, you fill up with more and more water as you require more resistance. Go up and down, up and down, up and down. Fantastic way to train your core, to train those front musculature of your core, your ventral surface or your anterior surface, whichever way you want to call it. So the next one is an exercise I have shown before, but it is that fantastic that I do highly recommend it. It's a standard front plank. So for a standard front plank, you'll be down on your elbows, shoulder width apart, up on your toes, and you're flat with the floor. See, I'm not up and bending, I'm not arched, I'm relatively flat to the ground. And you hold this for 30 or so seconds. If this is too easy for you, you can make it more difficult by doing things like take one arm, straighten out in front of you, bring it back, other arm, do the same things with your legs, raise your legs up. It's a great stabilizing exercise for your core. So that really helps to work the front surface of the front aspects of your core as well. The third exercise is called a Russian twist. So there's lots of different ways you can do a Russian twist. What a Russian twist pretty much involves is stabilizing with the front of your core musculature while doing some kind of a rotation to help train the side of your core. So for this, you'll see a lot of people using something like a medicine ball, which is fantastic to use. But you could also, as before, you can use a dumbbell or a milk jug where it's absolutely fine, filling up with an appropriate amount of water for the resistance that you need. So there's a couple different ways that you can do this movement. The first way, and I'll show you guys from a couple different angles here, starting from the side. Feet are on the ground. You're just going to lean back a bit. You're going to hold the milk jug. So I'm now stabilizing myself with my core musculature. Holding on here. I'm going to twist. I'm going to twist. Twist. And twist. You see, I'm not simply pushing out the milk jug. I'm twisting my whole core, bringing it down each side. You can choose to touch on the ground if you want. You by no means have to. But simply twisting and you're controlling the weight as it goes side to side, as it alters your center of gravity. So I'll show you from the front. We twist, we twist. You see, I'm not just going like this with my arms. My entire upper body is twisting. Entire upper body is twisting. If you want to make it more difficult, the next step is actually to elevate your feet off of the ground slightly. That's making your core hub having to stabilize even harder. And you continue with the twisting. It's a fantastic movement. So, the next movement is similar to a standard crunch, but it's with heel touches and alternating heel touches. So this one, what you'll do is you are down in the standard crunch position. You bring your heels nice and high, so your feet are nice and high, nice and up. Take your hands flat on the ground beside you. And all you're going to do is your goal is to keep your hands on the ground and simply slide them. So you're going to slide, touch your heel and back, and then go to the other side and back. Heel back, heel back. It's another easy way that we sometimes teach people to do a standard normal crunch too. Hands flat on the ground, and you bring both up and both down, and both up and both down, and both up, both down. It's actually one of the ways you do a physical preparedness test for people's core strength. It's a timed measurement of a reaching crunch. So, but for this one, to get a more kind of uniform abdominal workout, we're gonna alternate side to side. You twist, touch, twist, touch, twist, touch, twist, touch. So right side, left side. And that's a fantastic exercise that I often highly recommend. So moving on to the next exercise, which I've also shown before, is a side plank. So the side plank is recommended as part of the McGill Big Three, but I do find that it's a very highly effective movement to use to help really work on those stabilization muscles, so the core muscles on the side of your core. One thing people don't often think about is, at least in my opinion and a lot of the literature's opinion, stabilizing is the main use of the core musculature on the whole. All these muscles here are help to stabilize your upper body and your lower body and connect them. So doing exercises to increase the stabilization is very important. So lots of different ways that you can do this. First is on your elbow under my shoulder, come up onto your knees, making a straight line from between my knees all the way up to my head, straight line. So that is the first version. If you want to make it harder, you go out onto your feet, Once again, straight line. I'm not bending. I'm not over-arched. Straight line. If you want to make it more difficult, go hand up on top, or just hold down here, wherever you see fit. The final stage is you can actually do repetitions. If you're holding yourself up, you go down and curl, and then back up. Down and curl, and back up. Down and curl, and back up. I'll say same thing other side. This is a great one you can hold for 30 to 45 seconds and build from there. Once again, so I'm starting flat, with the camera, make it more difficult, go onto your feet, same principle. And if you make it more difficult, start doing rotating repetitions. Awesome. So we only have 2 exercises left, and those are going to be primarily to support our lower back musculature. Now, before I get into these, as I've stated previously, if you do have any issues with your low back, definitely get a formal assessment before beginning any too intensive low back exercise program. Can make things worse. Certain low back exercises are meant for certain scenarios with people with certain conditions or lack of certain conditions more often than not. So leave it to a professional, someone like a kinesiologist, an exercise physiologist, a physical therapist, to help prescribe proper exercise prescription for people with low back conditions. But uniformly, it's a little bit difficult to say this exercise will work for everyone. It doesn't really work that way. In the field, everyone is different. 2 people with the same condition may respond to using a certain exercise completely differently. Maybe the best exercise ever for someone, and another person it could cause a ton of pain or discomfort or tightness, and they could have the same condition. So everyone is a little different. Everyone's biomechanics are a little different. So when it comes to low back health specifically, though this does count for all exercise when you have injuries or you have medical conditions, but low back we see very often. Really be careful with it, and we highly recommend being assessed by a professional prior to trying to do any low back exercise when you have some type of medical condition present. So with that, the 2 simple exercises that I'll show you today. First is a Superman. So there are times to use a Superman, and there's times to not use a Superman. I'm under the impression personally that if you don't have any medical conditions, there's nothing wrong with doing a Superman. So for that, you're going to be laying down. Lots of different ways you can do these. Laying down flat on your stomach. Now, a couple different ways you can do these. The first one includes going alternating arms and legs. So left leg and right arm. You raise them up as high as you can. Hold it for a second and down, and you alternate. Right leg, left arm as high as you can, and down. Alternate. You go back and forth, nice and controlled. As you see, I'm not going crazy. I'm not going super fast or super hard. Going up, holding for a second or 2, and then back down. Another way is to do arms and legs at the same time. Now it will be a little more intensive. And you can hold it there. Seems like Superman. No, you can go flying. And obviously, for some people, it's simple as you can do alternating legs, alternating arms. For some people, what they'll try to do is legs, arms. Lots of different ways to do it, and to build on it as you get, more proficient at it. The final exercise that I'll show you guys today is the final exercise as part of the McGill Big 3 complex that I have explained previously, which is the bird dog. So bird dog, once again, we'll get down onto all 4s here. You can try and make roughly a table. So I'm not overarched. I'm not rounded or arched. That's a cat-cow. That's a different exercise. Another fantastic movement. We'll sit down for another day. But the bird dog, we're going to make roughly a table. So you see my wrists, elbows, and shoulders are roughly in line. So they're in a straight line, as are my knees to my hips. Making a table. Now, you take alternating arms and legs and you straighten them out. So right arm and left leg. Now hold that for 5, 4, 3, 2, one, and you're gonna bring those back in to where they can almost touch without curling around, and straighten out again. 1, 2, 3, 4, 5, and then down. So that's considered one repetition. And you do the same thing other side. 1, 2, 3, 4, 5, and in where they almost touch. Try not to round your back too much. And back out. 1, 2, 3, 4, and 5. So just show you guys another thing. You're gonna have your arms crazy high or your legs crazy high. What you do is be in roughly a straight line, parallel, roughly. It's never going to be perfect, but trying to work up to 8 or so repetitions each side is a fantastic way to help work that lower back musculature. And movement like that involves so many different, joints and movements. It involves some mobility and some stability. It's a great way to connect everything in your core and your torso and your legs for fluid movements and overall full body functionality and stability. So there you have it. Those are all the exercises today. Those are the 7 exercises for your core that I thought I would show today. As per I said, your core is not simply those visible muscles that you see on certain people on the front, like the 6-pack abs and all that stuff. It involves the 3 main layers of musculature on the front, the muscles on the side, and the muscles on the back that we went into. They're very important. And doing those 7 exercises is a simple way to kind of work through all of them. And there are thousands upon thousands of different abdominal exercises. I will continue to explore more of them and express more of them in further videos, but those are 7 simple ones. Like I also said, I would recommend working up to 3 or so sets of each of those, somewhere between 8 to 15 repetitions. Nice and controlled, nice and slow. Get that squeeze, really breathe out, And yeah, when you're able to do that, I think something that you can build up on by increasing reps, reducing the wait time, increasing sets. Reducing the wait time, increasing sets, adding more weights, so on and so forth, or looking at just doing more difficult exercises overall. So I hope you found that helpful. If you have any questions, feel free to post them down below. My name is Adrien. I'm the exercise specialist at the Leduc Beaumont Devon Primary Care Network. Thank you so much, and have a great day.